Okay, so let's go over contraindications and precautions because there's a few different ones and kind of more of them than we've had for some of our other modalities. So contraindications, any of our contraindications for our heat application, obviously then our thermal shortwave diathermy would apply. So look back at your superficial heating chapter and your ultrasound chapter to see those. Over sensory impaired areas, has been the same for most of our heating um, modalities. Over any plastic implants or bone cement, that was similar to our ultrasound as well, that those areas heat more significantly than the normal tissue, so we'd have concerns there. A patient who can't tell us and express the amount of heat that they experience, that's going to be a problem because we're going to use that to help judge our settings. Over the pelvic region, abdomen, lower back, lumbar region for pregnancy, that's been pretty common. Over cardiac pacemakers, implanted defibrillators, neurostimulators, any other implanted electronic device. And in fact, those individuals should actually not even be within 50 feet of the shortwave diathermy unit while it's on. And actually, they say the same thing for pregnant women as well. Over any metal that might be within the output field, so that could be on clothing like buttons or zippers. So, yoga pants with zippers, wouldn't, want to have those on. You'd want absolutely no metal, no jewelry. Again, even an implanted IUD, so intrauterine device for birth control could be a problem. Over any active deep vein thrombosis or thrombophlebitis, that could cause the clot to dislodge, and we don't want to do that. Active infection sites, again, just like our other heating, we don't want to stimulate the infection and the cells, as well as same with cancerous tumors. We wouldn't want to do that. If someone has a fever, we wouldn't want to use diathermy, really any of our heating with anyone with a fever. Over growth plates, there's some debate, just kind of like there was with ultrasound, of not doing it over open growth plates. Same with over the testes or the eyes or areas with a lot of joint effusion. Protruded nucleus pulposa, so someone who has a herniated disc, ideally potentially not doing diathermy over that either. So our precautions, a lot of our precautions deal with metal and metal in the area. So this chart shows you metal in the environment, metal near or on the patient, and metal in the patient that we'd all want to be aware of and think about. So each shortwave diathermy model is going to have individual thresholds and tolerance for the presence of metal. So always refer to the manual for definitive information, but these are things that you might not think about that you want to be aware of. So again, be aware of the patient's tolerance for the amount of heat applied. So we're going to be asking them about the heat they're experiencing and what that entails. Obviously, a precaution would be producing heat when they are contraindicated for that heat. So when heating wouldn't be desired, like in acute situations. Traumatic musculoskeletal injuries with acute bleeding. So we said it's really good for hematoma resolution, but not when the hematoma is still developing and bleeding. Acute inflammatory conditions. Again, we talked also about menstruation. We had mentioned that a little bit with ultrasound as well. So there's a likelihood that we'll get increased menstrual flow if it's applied over kind of the pelvic, abdomen, lumbar area. With the capacitive plates, there are some treatment mechanisms that put that on the skull, and that should be really cautioned because it can produce headaches, dizziness, vomiting. And I love this. I'd never heard this one before about contact lenses, that they should be removed before we apply shortwave diathermy to the face or the head. And it's because those can dry out and kind of heat up, and you don't want that on your corneas. So you should remove contact lenses. But most of what we would do would not be treating the head or the face anyways. So it's not usually a concern for us. Repeated use of shortwave diathermy over those growth plates, I mentioned that in the last slide, may result in malunion or non-union of the growth plate. And so it's a precaution. We usually try not to do it if they're still have open growth plates. And then any moisture in the electromagnetic field has to be controlled because it can increase the rate of heating. And so, if you had bandages over something, you'd want to remove those, especially if they were wet. Um, they shouldn't have any skin creams on. Um, Ideally, we even put a towel down over the surface of the skin so that it absorbs that moisture. Because otherwise, if moisture does collect, if they start sweating or things like that, we need to pause the treatment and then kind of dry the skin and then start back up again.